Hi, I'm Ed Bradley, and this is the 5 Minute Show. On today's segment, we will talk about sickle cell anemia. About 1,000 babies are born each year with this disease in America. Worldwide, this disease affects 500,000 newborns. In 1990 to 1994, 1% of all infants ages 1 to 3 passed away from this disease. We had a chance to talk to our own special guest from the University of Illinois, Dr. Bear. Welcome, Dr. Bear. How long have you been studying sickle cell disease?
I've been studying this disorder for almost 12 years.
So what does it do?
Basically, sickle cell anemia is when the red blood cells dysfunction and stop producing the hemoglobin protein, causing it to lose its normal circular shape and obtain a crescent flat shape, giving it a bigger risk of heart attack and blood clots.
Are there any cures or treatments for this disease?
There are no cures yet, but there are many treatments. One includes a blood and marrow stem cell transplant. It is actually a cure for a small number of people, but not significant enough to be considered a real cure.
So Dr. Bear, explain the science behind sickle cell anemia.
Sickle cell disease is an inherited disease. People who have it inherit two genes. For sickle hemoglobin, one from each parent. People who inherit a sickle hemoglobin gene from one parent and a normal gene from the other parent have sickle cell trait. Their bodies make both sickle hemoglobin and normal hemoglobin.
And people with the disease, do they live normal lives?
People who have sickle cell trait usually have few, if any, symptoms that lead live normal lives. However, some people may have medical complaints. People who have sickle cell trait can pass the sickle hemoglobin to their children. This chart shows an example of an inheritance pattern for sickle cell trait. Here you can see how sickle hemoglobin genes are inherited. A person inherits two hemoglobin genes, one from each parent.
Dr. Bear, at 8 years old, sickle cell anemia is making little Jonathan's life difficult. Protecting and taking care of your child can already be difficult, but when your child has sickle cell anemia, it can be a bit more challenging. We had the chance to talk to Jonathan's mother, Natasha, about it. Let's take a look. What is everyday life like for little Jonathan?
Life is so much harder for him and myself. He can't play with the other kids that often because he's prone to infections. He can't run around a lot like normal kids his age do because he has to avoid any activities that require large amounts of oxygen because his red blood cells can't carry as much oxygen as normal blood cells. It makes him feel like he's different and not normal, which makes me sad too.
Wow, that must be really hard for you. What type of diet does Jonathan have?
Well, normally he has large amounts of proteins, vitamins, and liquids. He needs to eat veggies, but he doesn't know how good it is for him.
I can relate to that. So who did little Jonathan inherit the disease from?
Well, my dad passed away from sickle cell anemia when I was very young, so I inherited it from my dad. Jonathan's father and I are both heterozygous dominant carriers for the disease. It was a 1 out of 4 chance for him getting sickle cell anemia, so he's homozygous recessive for sickle cell anemia.
Wow, 25% chance of possibly getting it, and he inherited it. That must have been hard for you to find out.
The saddest part is knowing that I passed it on to him, waking up every morning and realizing he inherited sickle cell anemia from me.
Surely you didn't know.
We knew it was a 25% chance, but we prayed it wouldn't pass on and continue on to our grandchildren and our grandchildren's children and so on.
Hopefully it doesn't. Thank you for coming out this morning, and a big thank you for sharing your story with Jonathan. On this segment of 5 minutes, we focused on sickle cell anemia, discussing the symptoms, the social impact, and everyday challenges people go through. We're looking forward to possible cure. A big thanks from everyone at 5 Minutes, to Dr. Bear and Natasha for opening their hearts up to us and informing us about sickle cell anemia. Thanks for tuning in to this segment of 5 Minutes. Good night, America. I'm Ed Bradley, and this is the 5-Minute Show. On this segment, we will talk. Dude, shut up.
See, their kids have the recessive. See, it makes sense. Like the kids are down here, the dad and the mom, and then this side of them is. See, I did don't. They'll have to receive immediate medical attention for infections and schedule regular doctor appointments.
I'm Ed Bradley, and this is the 5-Minute Show. On this segment, we will talk about sickle cell anemia. About 1,000 babies are born with this disease each year in the United States. Worldwide, this disease affects 500,000 newborns. In 1990 to 1994, 1% of all infants ages 1 to 3 passed away from this disease. We had the chance to talk to a very special guest from the University of Illinois, Dr. Bear. Let's take a look.
2 genes. For sickle hemoglobin, 1 from each parent.
Go.
Hopefully it doesn't. Thank you for coming out today. And a big thank you for sharing your story.
Wow. Mustache alert.
Jonathan's dad and I are both heterozygous dominant carriers for the disease. It was a 1 out of 4 chance for him to get sickle cell.